Lee Fang of The Intercept has a great article on a concerted effort by healthcare lobbyists to oppose universal healthcare. So we knew they were doing this for a long time. Now we have a direct story here that exposes it. So he explains the campaign in Colorado to create the nation's first state-based single-payer health insurance system, providing universal coverage and replacing insurance premiums with higher taxes, has barely begun. But business interests in Colorado are not taking anything for granted, and many of the largest lobbying groups around the country and in the state are raising funds to defeat Amendment 69, the single-payer ballot question going before voters this November. The Council of Insurance Agents and Brokers, a national trade group, is mobilizing its member companies to defeat single-payer in Colorado. There you go. So, all these different health industry businesses are saying, yeah, we don't want that because then that'll cut into our profits. So we're going to lobby against it. And what are they going to do? Unquestionably, they're going to lie. Now, we've seen this before. I mean, we've seen this on the marijuana front. They come up with the most deceptive commercials you've ever seen. And even when they had gay marriage on the ballot in California, this is obviously before the Supreme Court case, they purposefully made it confusing so that you didn't know, if I vote yes, am I voting for gay marriage? Or is it if I vote no, I'm voting for gay marriage? It was hard for people to get it. There were ads when it comes to marijuana like, if you want to legalize it, vote this way. And then the way they would tell you to vote is to not legalize it. I mean, this is the kind of crazy shit that they do. Well, this is exactly what they're going to try to do here with healthcare. So they're going to try to make it seem like, oh my God, you're going to pay more money and you're going to get worse care if you have a single payer system, when that is not true. And remember, who has the most to lose when we have a single-payer healthcare system? The health insurance companies. Why? They are a cash-sucking, predatory middleman. We don't need that middleman. So think about it. You pay money to somebody where you say, hey, if some shit happens to me and I need health care, you're my insurance company, so you pay with the money that I've just given to you in premiums. But what do they often do? They go, okay, totally, no, we're going to do that, but you have a copay of like $3,000 first, and then I'll pay for the shit on top of that. What the fuck? I've been paying you money every single month, and then when something happens, now I got to pay $3,000 out of pocket first, and then you pay after that. Well, why the fuck have I been giving you money? Why do I need to pay $3,000? You fucking pay. I just gave you all the money. You pay. Well, it's set up for that reason. It's set up to fucking rob you. That's the whole point of the system. It's a for-profit health insurance system. And how do you make money in a for-profit health insurance system? By denying care as much as possible. So when somebody says, hey, I have this issue, they go right to the contract and they go, because of Clause 37, Article A, subsection D, we don't have to pay because that was a pre-existing condition that you didn't tell us about beforehand. You know, we've covered this story on air before. There was a woman who needed cancer treatment, and her health insurance company went back in time and they looked at her records and they found that there was a time when she had acne as a kid. So they said, we're not going to pay for your cancer treatment. She's like, what the fuck? It was acne. They go, no, you say it was acne. We say it was cancerous skin lesions. Therefore, you already had cancer once and didn't disclose it. Now we are well within our legal rights to not pay for your treatment. This is the system we have. The way you make money as a health insurance company is to deny care as much as possible to pad the bottom line. And then to put the cherry on top of that, as you deny care to people, you also run ads on TV where you talk about how you're the best health insurance company. Why? Because you need more money, because that's the whole point is profit. Guys, I'm not against the profit motive in every single circumstance. I'm just not. There are some areas where it turns out that's a good incentive. Making video games, making couches, hey, compete for the lower price and the best quality. It works in that realm. It just doesn't work for health insurance because it's a perverse incentive. You're going to want to make more money, and the way you make more money is denying more care. That's how you pad the bottom line. It's a disgusting system, and they're going to try to mislead you to not get the single-payer system because they know eventually that'll put them out of business. Why? What they're doing is useless. We don't need them. We could have a single insurer, a single payer, the government. That's what single payer means. That's the way to go. And don't buy the nonsense. You will save money in this system. You may pay a little more in taxes, but you get such a gigantic cut in your private insurance premiums, you don't have private insurance premiums anymore, that you will net save money. Don't buy the propaganda. Don't be stupid. Go look at the data for yourself. In all the countries that have a single-payer, government-run health system, they do much better than us in every relevant category.